Welcome back to our Journal Club, where today we're diving into a critical topic for cancer patients: how long should anticoagulation therapy last after a pulmonary embolism? Pulmonary embolism, or PE, is a serious complication of cancer. It's part of a larger issue called venous thromboembolism, which includes both deep vein clots and PEs. Managing this condition involves anticoagulation therapy, commonly referred to as blood thinners. But there's been a big question looming: how long is long enough to keep patients on these medications without overexposing them to risks like bleeding? A recent study in Japan took on this challenge, focusing on patients with cancer who had low-risk PEs. These are cases where, aside from having cancer, patients don't exhibit other severe symptoms of PE. Researchers compared two durations of anticoagulation therapy, 6 months versus 18 months, using a drug called rivaroxaban. Here's what they found. While the study faced setbacks, including an early termination due to slow enrollment, the results were still striking. Recurrence of venous thromboembolism was significantly lower in the group treated for 18 months, only about 5.6%, compared to 19.1% in those who stopped at 6 months. That's a big deal. And here's the clincher: the longer treatment didn't result in significantly higher rates of major bleeding. Serious bleeding occurred in about 7.8% of patients on the extended therapy versus 5.6% in the shorter group. Importantly, there were no fatal bleeding events. This evidence could reshape how doctors approach anticoagulation in cancer patients with low-risk PEs. The takeaway: 18 months of treatment appears to offer substantial protection against recurrence, with manageable risks, even in a population that's already more vulnerable due to cancer. For doctors, this study adds a compelling reason to lean toward extended anticoagulation when treating cancer-associated PE, at least for patients who don't have a high bleeding risk. It underscores that longer treatment isn't just about playing it safe, it could be life-saving. So, what's next for patients and providers? Open conversations. If you or a loved one has experienced a cancer-associated PE, this study suggests asking your doctor whether extended anticoagulation is a good fit. Balancing the benefits of reduced recurrence with the risks of bleeding will always be personal. But this study gives both sides of the discussion stronger footing. That's all for today's episode. Please like and subscribe to our channel to stay informed and up to date.